Are you hurt or sick because of your job? In Ontario, many workers have a right to workers' compensation if they're hurt or sick because of their job. This compensation is through the Workplace Safety and Insurance Board, or WSIB. About 75% of workers in Ontario are covered if you miss time from work because of a work-related injury or illness, and you file a claim with WSIB and it is approved. The compensation may cover some of your lost wages. If your work-related injury or illness claim is approved, the compensation may cover related healthcare costs. Find out if the work you're doing is covered under WSIB. Don't wait until something happens. When you start a job, or if you already have one, find out if your employer has WSIB coverage. Ask your employer, your health and safety representative or committee, your union, Office of the Worker Advisor. For non-union workers, the toll-free number in English is 1-800-435-8980, and in French is 1-800-661-6365. Ask a legal aid clinic, 1-800-668-8258. Ask to speak to someone in your language. In WSIB, 1-800-387-0750. Ask to speak to someone in your language. If you're not covered by WSIB, you might qualify for other supports, including the employer's sick leave or disability insurance, the disability payments through the Canada Pension Plan or the Employment Insurance Program, Ontario Works or the Ontario Disability Support Program, and a court case to sue your employer. Get help to figure this out by asking a legal aid clinic, the Office of the Worker Advisor, or the office of your member of the provincial parliament. If you aren't covered by WSIB, follow these steps. First, tell your employer or supervisor when the injury happens or when you first notice something is wrong, or you start feeling sick. Tell them if you get hurt or sick, however small it seems. Document any detail about the injury or illness, when it happened or first started, and document when you brought the injury or illness to the attention of your employer or supervisor. If your workplace is unionized and or has a healthcare and safety representative or committee, inform them of the injury or illness. You may also tell your coworkers, especially if it's related to an infectious disease like COVID, or some of them might have the same injury or illness and have not reported it. If the injury or illness is serious, or in the case of a workplace emergency, get help from someone trained in first aid, seek medical care right away, or call 911 if emergency medical care is needed. When seeking medical care, you can go to your own healthcare provider, a community health center, a walk-in clinic, or a hospital. You have the right to independent medical care and to privacy when seeking care. Your employer or supervisor should not be present in your consultation. Connect to community support agencies if you need information on where to seek health care or if you need interpretation or transportation support. If you need interpretation, ask the healthcare provider for support in your language. Tell the healthcare provider that your injury or illness is or may be related to your job and that you want to file a WSIB or a workers' compensation claim. The healthcare provider will fill out and submit WSIB's Form 8. You, or the injured or ill worker, will have to fill out WSIB's Form 6 and provide detailed information about your injury or illness and what has happened. Get help from community support organizations or legal clinics to fill out Form 6. You can also call WSIB to help fill out the form. You can call them at 1-800-387-0750. When you get an answer, ask to speak to someone in your language. The WSIB provides interpretation for phone calls and meetings. You can arrange for letters to be translated into your language if you need them. Be sure to ask for this help if you need it. For more information or instructions on how to submit your claim, you can visit www.wsib.ca. You can go to several places to get help to make your claim. The Office of the Worker Advisor is set up to help people who do not have unions at their workplace make WSIB claims. They work in English and French in 15 offices around the province. You can call them about WSIB claims at the toll-free numbers. English is 1-800-435-8980. French is 1-800-661-6365. You may need to find someone to help with interpretation. Legal aid clinics also help people with WSIB claims. Find the nearest one by calling 1-800-668-8258 or look at their list of legal aid clinics at www.legalaid.on.ca and then call that clinic. Ask to speak to someone in your language. The clinic will let you know if they can help. The Occupational Health Clinics for Ontario Workers, or OCAW, can help with medical or workplace exposure information. What happens next? Your employer also must fill out forms about your claim. They are copies of their forms as well as the form for your healthcare provider on the WSIB website or also on OCAW's website. Make sure you or the person helping you ask for copies of the form filled out by your employer or healthcare provider. If WSIB approves your claim, the benefits include replacing some of your lost wages if you had to stop working, along with medical expenses such as physiotherapy and more. What else can happen? Your claim might be refused. If it is turned down, you can appeal. Legal aid clinics and the Office of the Worker Advisor can help. If you need medical information or help to file a claim or an appeal, OCAW can also help. Again, here's how to reach them. The Office of the Worker Advisor is set up to help people without unions make WSIB claims. They work in English and French in 15 offices around the province. You can call them about WSIB claims at these toll-free numbers. English is 1-800-435-8980 and French is 1-800-661-6365. You may need to find someone to help with interpretation. Legal aid clinics also help people with WSIB claims. Find the nearest one by calling 1-800-668-8258 or check out their list of legal aid clinics at www.legalaid.on.ca and then call that clinic. Ask to speak to someone in your language. The clinic will let you know if they can help. The Occupational Health Clinics for Ontario Workers, or OCAW, can provide medical or workplace hazard help or information. They often work with legal aid clinics or the Office of the Worker Advisor on WSIB appeals. It can be scary to make a WSIB claim or an appeal. You don't have to do it alone. You should also know that it is illegal for your employer to punish, fire, or retaliate against you in any way. If you make a claim or appeal a decision about your claim, if you think this has happened to you or might happen, talk to people helping you with your claim. They will know what to do. This information comes in other formats. The infographics can be made into a poster. The wallet cards are available from OCAW and community partners. This presentation was funded by the Ontario Ministry of Labour, Immigration, Training and Skills Development under the Newcomers Empowerment Project. OCAW has other information about hazards and health and safety on its website at www.ocaw.on.ca. For copies of workers' rights information, please see OCAW's website under Workers' Perspective.